Lovely. So hi everyone, I'm Katrina. I'm a social worker and I'm a senior mental health practitioner. So this is my poster presentation for the pre-doctoral fellowship. And yeah, just wanted to say thanks to my supervisors as well. So I had Karina Lavelle and Filippo Veriz, and they were amazing. I couldn't speak higher of them. So my project is around empowering community mental health team staff to routinely inquire into trauma and abuse. Okay, so firstly, let's have a look about what we already know about the area. So we already know that experiencing abuse or trauma is common in the general population, and we know it's common that it's significantly also linked in with people who under secondary mental health services, so diagnoses such as psychosis, bipolar affective disorder and personality disorders. So what are we doing about it? So research has said that exploration of these difficulties has been found to be therapeutic for patients, and in 2008 the Department of Health recommended that these abuse, traumas and adversities should be explored on every access to secondary mental health services and within care planning as well. So more recently, further research has found that it's still not happening in most mental health trusts, and that there were unacceptable levels of training on how to introduce the trauma inquiry and how to respond to any disclosures. So why are we not doing anything about it? So separate research has looked into what the barriers were to the routine inquiry, and they found that this was around fears of opening up a can of worms, staff underestimating the therapeutic value of it, and also low staff confidence and lack of training in the area. So what have people with lived experience of trauma and abuse and mental health services said? So they have said that being asked about their experiences helped them to feel listened to and validated, but that not being asked felt damaging and dismissive. Therefore, there's a great need to improve mental health professionals' knowledge and confidence about not only asking about trauma and abuse, but also in responding to any disclosures. So that's where this project came in. So what we did was we did a Freedom of Information request was sent to all mental health trusts in England, and this revealed that over 70% of mental health trusts had no training at all around trauma for their mental health staff. Over the year, we held co-production workshops with PPIE groups with people with lived experience of trauma and abuse in secondary mental health services, and resources were developed for training around the routine trauma inquiry for CMHT staff. So there was a training module created, a training manual, a toolkit and a staff wellbeing pledge that was created. Baseline scores for the routine trauma inquiry were gathered from business intelligence reports for the previous 2 years, and then mental health professionals were recruited from one community mental health team. They were given a pre-intervention, a post-intervention and follow-up questionnaires 2 months after the intervention of the training, and this was to record confidence and their knowledge in the area. Participants were also invited to complete a semi-structured interview post the intervention, which could delve a little bit deeper into their views on the training, their confidence levels and knowledge base. And results found signals for change, and all participants recorded higher levels of confidence and knowledge after the training, and this was sustained after the 2-month follow-up as well. So what implications does this have for future research? So this research raises queries around whether mental health trusts are actually complicit in re-traumatising patients if their mental health team staff are not trained. Future practice needs to take this into consideration to prevent re-traumatisation. The results in this project found that most participants recommended that the training should be delivered to all CMHT mental health professionals. And the research also recommends that all mental health professionals in different settings should be provided with mandatory training around trauma, abuse and adversity to be more trauma responsive and trauma informed in their practice. And future research should be completed by scaling up this study to be trust-wide and then analysing the significance of the impact of this. So the PhD question then, so that brings us to, so can further training around the routine trauma inquiry impact mental health professionals' confidence and the patient experience around trauma inquiry within community mental health teams? The co-produced training module should be co-delivered with lived experience consultants to all community mental health teams in Manchester. And the routine trauma inquiry question and assessments and care planning documents should be reviewed and analysed, so pre, post and 6 month follow-up after the intervention. Semi-structured staff interviews should be completed on a wider scale across the trust to gather views around confidence and knowledge, and semi-structured patient interviews and questionnaires should be completed to explore any impact on the patient experience. So what did I get then from this pre-doctoral fellowship? So I had no experience in research really before this, so it was a huge learning curve for me. So I attended and passed the critical appraisal and evidence synthesis module at the University of Manchester. I received a certificate for good clinical practice training, and I completed my first ethics IRAS application, which was very eye-opening. So I also completed the process for sponsorship trust green light approval. I learned how to execute a systematic review, prepared and learnt how to write a protocol, learnt about how to recruit and engage with PPIE groups. I finished writing a research paper for peer review, and explored the process around publishing an article, and learnt skills about presenting my research topic and sharing knowledge as well. And the outputs that I had, so following on from that, so I presented this project at the Trauma Informed Quality Improvement Conference. One research paper has been submitted for peer review to the Journal of Psychiatric and Mental Health Nursing, and this has been accepted for publication with some small revisions. Several PPIE workshops have been completed over the year, which was actually really useful, and you know, I think that benefited everybody involved. And resources have been co-developed and co-produced with people with lived experience of trauma, adversities and secondary mental health services, so I mentioned them earlier. And all these resources have also been shared with the Trauma Informed lead for the Trust. And I've got a further research article being developed at the moment for publishing, which is currently in preparation. So I'd just like to close it off by saying a further big special thank you to all of the lived experience consultants involved in the project, because that was really invaluable. And I'll open it up to questions.
Thank you, Katrina. It's an incredible amount of work to do. So you did that as a 1 year 50%.
Yes, and it was very ambitious, and that's probably why it's still not quite finished. But yeah, I think I definitely bit off a little bit more than I could chew, especially like, you know, working. And I think obviously all of our jobs are super busy as well, so it's not, you can't always exactly do 50, you know, even when you're on your days in, you're working extra, aren't you? So it was a lot, but we did it.
So that's a huge celebration, and I loved when you said I got ethics application, and that was an eye-opener. Yeah. Do you want to tell me a little bit more about what you learned about ethics applications?
Yeah, so well, I learned absolutely everything about them because I'd never done one before, but they take significantly longer than you think it will. Even just the system that you use it on, you know, it's very pernickety. Everything has to be, you know, in the right wording and in the right place. And, you know, I just say, if anybody else, you know, for future people, if they are doing one, just, you know, maybe well overestimate how long it's going to take. Yeah. And I think if it had been, I think I was quite naive really with thinking how long that would take. And I think if that was quicker, I might have been able to finish things a bit earlier, but we live and we learn.